Good morning, and welcome back to Good Samaritan Facebook Live. My name is Dr. Scott Stine. I'm a family physician here in Vincennes, Indiana, and Chief Medical Officer of Good Samaritan Physician Network. Joined today again, Adam Thacker, who's our Chief Operating Officer. As usual, we're going to be giving you a weekly update on the status of COVID-19 in our community. A little bit about testing, of course talking about masking and some precautions we've been taking as far as getting our kids back to school, sports, and then kind of where we go from here and what to look at over the next few months or so. So Adam, if you wouldn't mind, give us a rundown on where we're at on our current statistics.
Yeah, so from a numbers standpoint, 272 cases in Knox County, 72 active, as we've talked about many times. The active cases is really the important number as we look forward, because that's the ongoing risk of transmission. So we have 72 active cases. So when you do the math on that, 26% of our cases are active, and that's pretty much in line with what the state is seeing in an overall standpoint. As we've seen that increased trend, that 7-day trend, we're a little higher of active cases on a county basis, but not too much. One other piece of data to mention is that 13% is our 7-day positivity trend. If you go to the ISDH coronavirus site, which I know many do, you'll see that they have now broken that out a little bit differently. So we're seeing that it's reported in a unique individual number, which is unique patient information. And then you'll see cumulative, which may include if there was an individual who tested positive at some point prior and then was retested and also tested positive, that will be included in there as well. Or if there's individuals that are retested negative and then test again negative and test again negative, you'll see that as well. So really that unique patient, unique individual is the numbers that we're looking at, because that tells us exactly where we're at.
And that's, when we look at things, one of the things that we've discussed in the past is this positivity rate. And we've seen a tremendous variation really in the past 3 or 4 weeks in the positivity rate. Our cumulative total positivity rate over the course of the past 3 or 4 months or so had hovered somewhere between 4 and 6% or so. And then we saw a tremendous rise over the course of the past 4 or 5 weeks. We sort of peaked, I know, last week or so, and we've come down a little bit in our positivity rate. But as Adam was talking about, one of the things that's been great as we have progressed through this is the quality of the data and the quality of the information that we make our decisions based on has continued to improve month by month. And so what you're talking about now, which is these unique individuals, breaking those out instead of having everybody in the same pot, helps us to be more accurate in determining what our status is right now.
Right. Yeah, when we started, so back in March, one of the immediate steps was the Indiana State Department of Health rolled out a reporting dashboard, and as that has continued to evolve over these last few months, it's really a robust tool now that we use internally even to go and look at that and see, make sure that the data we're reporting is rolling up correctly, but to look at counties around us and what that looks like. And there's a lot of ways to slice and dice that for data geeks such as myself. But we also now are seeing not only the dashboard for state and county, but there is a long-term care facility dashboard. And Dr. Box announced last Wednesday on the governor's update that there will be a school-specific dashboard as well that will be coming out sometime in September. We don't know the exact date, but just trying to really push that transparency of being able to go and look at the information. And then again, we're reporting that and looking at the Good Samaritan resources to meet what we're seeing in the county.
And I think all of that is important, just as doing our weekly updates, to help people understand that what we're doing is very important in terms of masking, typical universal precautions as we have gotten our kids back to school. You and I have met with our local superintendents, and it's very important to realize that all the measures that we're doing right now are very important because those rates have gone up, because our positivity rate has been up. And so I get asked nearly on a daily basis or hourly basis, it seems like, about how we're doing as far as the schools are concerned. And the reports that we've been getting is our children in schools are doing a very good job with masking. Schools are doing a very good job with that. We in the community, we in the workplace need to do equally well to what the schools are doing. Because as we move forward, that's the thing that's really going to help us over the course of the next few months. We've just started to kind of dip our toes into the beginning of our little viral upper respiratory syndromes that we see as school goes back in session, a little bit of viral gastroenteritis, those types of things. But we're actually seeing those numbers be less than usual also, because of our typical hand hygiene is better and masking is better, and all of our universal precautions are better. So we want to applaud everybody who's doing a good job with universal masking and all of our local retailers, schools, workplaces, things like that, because as we do better with that, we will continue to progress through the season more successfully.
Yeah, and on the school piece, I get asked about it daily as well, or even hourly. And we have seen some schools in surrounding areas that have either pushed back the start of their school, or we have seen some that have had to already hit the pause button and take a week off, or go to remote learning for a period of time. Our schools here in the county are doing an excellent job and are all really committed to being able to provide that on-site learning environment. Having positive cases from school-age children or faculty, folks in the school, is an inevitable fact of the spread of a virus. But we've been able to manage it very well. And as Dr. Stine mentioned, the masking protocols that have been put in place, the distancing, they're following those to where if there is a positive case, it's not happening at the school, it's happening in the external environment, and then they're identifying it through their protocols at the school. So feel really comfortable in the pieces that they've put into place, and we're partnering with them to provide timely care to students that are sent home or faculty that need to be assessed.
And that's one of the things that we frequently get asked, and we've implemented a number of measures to help the schools out with that over the course of the past few weeks. So question number one would be, if my child seems to be ill, what do I do with them? And this is prior to going to school. So the answer, of course, is don't send them to school. And that would be if they have a fever, and we would consider a fever 100.4 or above. We would prefer that everybody monitor their own temperatures at home prior to going to school and prior to going on the bus. We don't really want to wait until that child has already ridden the bus, already gone to school. So please monitor your family's temperatures at home and be cognizant of not sending them if they have a fever or if they have symptoms that would be concerning for COVID. Now, that is a little bit of a catchphrase right now because that encompasses a tremendous spectrum of illness because we are starting to enter our cold season and our viral upper respiratory season, and we are getting ready to enter our ragweed season as well. And so it's really the spectrum of what symptoms your child has. It may not be just a runny nose or just a headache, but if they have fever and they have a compilation of a few symptoms, it's important to get in touch with your provider to determine what the best course of action is, but not to send that child to school. We are set up to basically do testing through multiple sites around town, but also to get people in touch with their provider from a primary care standpoint, and then also if they don't have a provider, to get them in touch with a provider.
Right, yeah, so if already established with a primary care provider, then you'll go through that office as the first option. If they're able to get you in timely, then there's already a continuity of care there that we want to continue to follow. If not, we have find a provider lines, both phone lines as well as online resources, and then our convenient care clinics can be used for same-day walk-in. And we've created a process with the school nurses at each of the 4 schools within the county that are working directly with one of our advanced practice nurse practitioners to be able to coordinate care and make sure that folks can be seen. And that may be a virtual visit that's able to be performed without child having to leave home, or that may be an in-person visit, or a combination thereof that starts as a virtual visit and then there's a further assessment. So those avenues are available. You can call our Find a Provider line, you can go online and find that, or call the main hospital number and we can get you sent out to that clinic where somebody can help to direct the care.
Yeah. And certainly if anybody, adult or child, is ill, meaning that they're not eating well, they're not drinking well, they're having respiratory symptoms, we want that call to come quickly. We want them to get in to be seen quickly and be clinically evaluated. Obviously our focus is keeping our children in school and keeping our teachers and staff safe, but we also want to make sure that the primary focus is that we see those people that are ill. We've been very fortunate as we look through the course of the past 4 or 5 weeks or so, even though we have seen a tremendous increase in the number of cases and an increase in the positivity rate, the number of really ill people that have had to be hospitalized has been very small. And more importantly, the number of really ill children has been almost non-existent. So the children who have had the illness generally tend to be very brief, tend to not require any type of medical treatment. They go through the typical quarantine process, become fever-free, and then return back to school.
The hospitalizations that we've seen, and we mentioned the numbers, 270 plus cases, 72 active, and we've been anywhere 5 to 10 hospitalized COVID positive patients really since the 4th of July. It was less than 5, pretty typical prior to that. So we have seen that increase a little bit, but when you look at 5 to 10, but we have capacity to take care of hundreds of patients. Our resources we're very comfortable with where our resources are from a medical care standpoint, from our clinical staff standpoint, ventilators, things like that you hear about, we're equipped to take care of a much larger population that ideally we won't see, and in this county we have not seen that need at this point.
One of the other things that we frequently get asked about is our long-term care facilities. What's happening there? How are those that population being protected? How's their staff being protected? And it's a very difficult time for that population because their family members want to visit them. Many facilities have very limited visitation type policies right now, which is difficult for the family member and also difficult for the patient as well.
Right.
We are helping those facilities as far as care of those patients, and also helping to keep the ones in those facilities that need to stay there and getting the ones to the hospital that need to be cared for. But it takes a tremendous amount of patience on the family side to realize that really using these virtual visits for their family members and being on the iPad and FaceTime and things like that are probably one of the most safe methods to communicate with those family members. And we know that's a difficult time for everybody right now, but that's one of our most at-risk populations. And we look at some of the patients that have been the most sick in the state and around the nation. It has been those patients that have come from long-term care facilities. As far as testing is concerned, we get test questions nearly every day as far as what type of testing are we doing, where are we doing it, what types of facilities, and then there are a variety of other types of test options available around the state and through other independent labs, and we hear now about saliva testing, a variety of other things. I'm going to tell everybody just briefly what we have set up locally and what we've been looking at also.
Sure. We are continuing with our testing sites at Convenient Care. We also have a test site at MCV Medical Center that can be directed by your primary care, and we're now partnering with the health department, Dr. Stewart's group, to set up a third testing site that will be coming in September to increase availability for tests for those that are seeking that. Our tests are the PCR tests, so molecular tests that are performed via nasopharyngeal swab. It's an uncomfortable swab, so if you are just mildly ill and can stay home and get to feeling better, then certainly want to do that. There are also state-sponsored sites that we have mentioned before in Gibson County and in Vigo County that are through the state program. Those are not part of Good Samaritan, so those results don't come back to us, but those are available testing sites that are free testing sites. At our sites, we've been very committed to a provider assessing individuals for appropriateness. And as Dr. Stine mentioned, we're entering a season where there are many alternate explanations to what may be going on other than just COVID, and we certainly want to be able to have a provider assess you effectively. And then we're also offering antibody testing that we have talked about in the past. You're probably, if you're one perusing the news feeds on COVID, you're seeing in-home testing, saliva testing, all different versions. We're staying very strict to what the CDC and FDA approval and recommendation processes are. So with testing, specificity and sensitivity are really important. That's what tells us how accurate a test is in detecting the positive virus, and also how accurate or how much we can avoid having false positives. The problem with some of those other tests is that they have much less accuracy and reliability for decision making. So worst case scenario would be to roll out widespread testing with an available, let's say, saliva test that is not as accurate as what we've seen, and we're making decisions off of that information that may or may not be pointing our clinical team in the right direction. So we have made the decision that we are going to stick to the tests that have been vetted as the most accurate, most appropriate tests to be performed.
Yep. And as we move forward, it's always important to go back to what we've said all along, which is that the testing itself doesn't change anything about the care at this point. As we move through the course of the next few months or so, we frequently get asked, well, should I get tested before I go back to work? Should I get tested before I go back to school? And really the quarantine process and that initial assessment is far more important than the I got a test and it was negative, because as we know, if you get tested on a Monday, that does not necessarily mean that your test is negative on a Wednesday or a Friday after that. So although the testing is important and the diagnosis is important, we don't want people to be purely focused on the fact that they get that testing done. Same thing is true of antibody testing. Adam mentioned antibody testing and that's been available, but the value of that is very limited. One of the interesting things that has come up through the Red Cross and the blood drives is that if you go to donate blood, you will automatically get antibody testing performed. And so those of us that donate blood, we kind of like to do that on a routine basis anyway, and the Red Cross reaches out to you, realize that that's now part of their protocol also, is to get antibody testing performed. And that's kind of a benefit beyond your pins and your credits and everything else that you get, is that you get some antibody testing done performed as well. So we encourage everybody to continue donating blood. That's all being done in a very safe manner now. How they're operating those blood drives and everything is safe as far as keeping everybody from transmitting the virus. So we would encourage everybody to continue with their blood drive donations. Any other particular topics you wanted to touch on today before we go to the phones?
I think we can see what kind of questions we've got.
All right, Tiffany, what do you got?
Did we cover everything so well we don't have any questions?
I think that's the case. You guys did a good job, apparently. There are no questions.
All right.
Okay.
Well, obviously, we'll be watching online throughout the day. If people have questions throughout the day they'd like to have answered, please submit those. Adam and I will be back with you again in a week or so, and we encourage everybody to stay safe, wear your masks, do your universal precautions. That's keeping us all out of trouble, keeping our kids in school, keeping our kids in sports, and keeping us at work.
Right.
So thank you all for joining us.
Thank you.